called stroke. But let me introduce myself and my group members. My name is Shanonzaba binti M Bakri, and my team is Rahman Putra binti Yunaidi, Nur Nasreen Izzani, and Liawanti. Do you know about stroke? Let me explain. Stroke happens when the blood flow stops flowing to any part of your brain, damaging brain cell. The effect of a stroke depends on the part of the brain that was damaged and the amount of damage done. Knowing how your brain works can help you understand your stroke. There are various types of stroke. The effect depends on the type of stroke, the part of the brain that was damaged and the amount of damage. For instance, ischemic stroke, which caused by a blockage or clot in a blood vessel in your brain. The blockage can be caused when a substance called plaque builds up the inside wall of an artery. Next, hemorrhagic stroke, which causes when an artery in the brain breaks open. The intraflow flow causes damage to our brain. High blood pressure weakens artery over time and is a major cause of hemorrhagic stroke. And last but not least, transient ischemic attack, or known as TIA, is caused by a small clot that briefly blocks artery. It is sometimes called a mini stroke of warning or warning stroke. The TIA symptom usually lasts less than an hour and may only last a few minutes. TIAs are an important warning that a more serious stroke may occur soon. They are a medical emergency. There were various symptoms of strokes, such as trouble speaking and understanding what others are saying, paralysis or numbness of the face, arm or leg, problem seeing in one or both eyes, trouble walking, and last but not least, headache. According to the latest World Health Organization data published in 2018, stroke death in Malaysia reached 30,799, or 9.80% of total death. The age-adjusted death rate is 62.64 per 100,000 of population, ranks Malaysia 107 in the world. This is serious matter since the stroke is the top 3 causes of death in Malaysia. However, there were some patients survived their stroke. They were called as the stroke survivor. Therefore, I would like to do a talk show with one of the stroke survivors to further understand the stroke. So lastly, let me introduce our stroke survivor, Encik Raja Iskandar. Please enjoy the show.
Assalamualaikum and greetings to all persons that are watching this video right now. Today, we are very lucky because we have a superhero that I would like to introduce and do a talk show with him, with my other teammates, which I would like to introduce first. So, I'm Rahman Putra bin Yunaidi, and the other is Nur Nasreen Izzani binti Muhammad Zamri, Shanonzaba binti M Bakri, and Liawanti. So, to start off, I would like to pass this to Nur Nasreen Izzani.
Okay, first of all, Encik Iskandar, would you care to introduce a little bit about yourself?
Hello, good morning. Nama saya Raja Iskandar bin Raja Mansur. I'm a stroke survivor.
So, Encik Iskandar, may I know how the stroke happened on you?
I was stricken by stroke about 7 years ago when I was 48 years old. It happened almost exactly 7 years ago on the 22nd of December.
I am very sorry to hear that, Encik Iskandar. So, what are the symptoms for your stroke, Iskandar?
Okay, my symptoms prior to getting the attack was I had my eyes was in pain, as if something is in the eye. Yeah, the saliva was uncontrollable, and then I suppose everybody has their own different symptoms pertaining to themselves, but These are the common symptoms that I think happens to people. Pain in the eye, and then the saliva movement.
I see. So, how do you overcome stroke? In both emotion or any activities and exercises that you have carried out?
So art attacking has been my weapon, my tool to get medicine to heal on my emotional side. And if you ask me what has stroke done to me, I would tell you it has done a lot of good. It has enriched me as a human being, and kita perlu redha dan selalu ada hikmah sebalik sesuatu. But not to forget the emotional aspects of healing on top of the medicines that you take from the doctors. There is the emotional side of the healing from stroke. So that's what I'm going to talk to you a bit later.
So I'm really grateful that in Iskandar you have actually gone through all of these obstacles. And in your opinion, what is the most effective way that you would like to suggest to other stroke patients for them to get recovered soon?
As a result of my OKU attack, I had become a documented OKU myself. So I'm beginning to understand, I'm beginning to feel for the other OKUs in the community, because I'm one of them now. So, but I'm an OKU that can help those around me. So I registered a little social enterprise called Art Attacking Raja Is, which I made into a platform where I do my outreaches. And one of the outreaches involves helping other OKUs in a creative manner. That's what I did, and that has become a very good.
Oh, so Iskandar, this is the last question from me. I'm just wondering, based on your experience and challenges that you have faced, among all of the stroke patients, does the recovery rate high?
Okay, there's so much you can talk about the attack of stroke, but the recovery from stroke is another matter altogether. So one of the things that I practiced as a stroke victim is that I would follow the medicine that is prescribed to me by the doctor to the T, not failing. Although the other methodology of healing is I also dabbled in outreaches in where I started to help other less fortunate people, especially focusing on their children. I help blind children or parents with normal children, but they are blind, the parents are.
What has changed in your life after stroke? And what are you doing now that you did not do in your life before stroke?
Before stroke, I was happy, a very hardworking landscape designer. I like nature and I like to beautify spaces, and I like to work with nature. I am an environmentally friendly person. So that's where I went back when you talk about healing from stroke.
Thank you very much for the opinion, Encik Iskandar. It is very informative and beneficial, especially among the youth like us, because it can happen to anyone, no matter what the age is. Even a baby can have stroke. So it is good that we keep in mind and spread of this stroke awareness to everyone. Encik Iskandar, it is our great hope to see you in this healthy condition right now, because it gives us the inspiration to stay strong and live the life to the fullest. I hope in the future we can talk more about this. So, I would like to thank you again, Encik Iskandar, for spending your time with us, my teammates who have participated in this talk show, and the people who have watched this video until the end. May God bless all of us, inshallah. So I end this video with Assalamualaikum warahmatullahi wabarakatuh and salam satu Malaysia.